Good afternoon, everybody. I want to thank you for joining us today for Healthy Minds, Healthy Bodies. Today, we're going to learn all about prediabetes, a guide to preventing type 2 diabetes.
And then good afternoon, everyone. My name is Cheryl Teschner. I'm a registered dietitian. I also work as a certified diabetes care and education specialist in our nutrition and diabetes department. And so today we're going to be talking about the subject matter of prediabetes and preventing type 2 diabetes. And so what we see here on this first slide is we're going to cover kind of what that topic is, how common it is, and a bit of the pathophysiology. So what happens in the body when we're talking about blood sugar management or blood glucose management, and when that's not working correctly. So this is as you can see from the statistics on the slide, these are from the CDC, that prediabetes is a very common health condition among adults in the United States. So 96 million adults, or more than 1 in 3 folks, have the condition of prediabetes where blood glucose is running too high. Kind of the more significant statistic here when I look at this information is that more than 8 in 10 of those individuals aren't aware that they have prediabetes. So prediabetes, that's a condition where there really aren't a lot of signs or symptoms that something is not going right in the body. And then prediabetes, it's a precursor to type 2 diabetes. And this is a process that develops over a span of years for most folks. And then risk factors, what makes a person more likely to have prediabetes? We have several items listed here. So being overweight or having obesity. Once we start to get a bit older, so age 35 and older, if you have a family history of type 2 diabetes, so if you have a mother, father, brother, sister, those direct family members, that makes you more at risk for developing prediabetes or type 2 diabetes. If a person is less physically active, so being active less than 3 times per week, that increases risk. And then these next two are just for women, just for females. If an individual has had gestational diabetes in the past when they were pregnant, so that's diabetes and pregnancy, or if a woman has polycystic ovary syndrome, that is something that also increases risk of blood sugar running a bit too high, prediabetes and type 2 diabetes. And our last bullet point here is if a person belongs to a certain ethnic group. There are some ethnicities that have a higher risk for developing prediabetes and type 2 diabetes. And if you're reading through the slide here and finding that any of these risk factors are true for you, it most likely would be a good conversation to have with your primary care provider to talk about regular screening for elevated blood sugar readings. Because as I mentioned, there's really not any kind of red flag symptoms or signs that people experience when blood sugar is running a bit on the high side. So our pathophysiology, this first slide is talking about without diabetes, so more normal glucose blood sugar metabolism. And just some steps to kind of break it down a bit. Foods that we eat, those get broken down in the stomach, they're digested, and then those nutrients, they're absorbed into the bloodstream. And carbohydrates, just a side note here, those are the food type that they break down to glucose or sugar in the body. Kind of our second step is the pancreas. That's another organ in our body that helps with digestion and it helps with blood sugar control or blood glucose control. So the pancreas makes and releases a hormone called insulin. Step 3 is insulin. It essentially acts like a key. The cell, as we see here in the diagram, it kind of has a door or an entry point, and insulin helps to open that door to let the glucose into the cell or let the blood sugar into the cell. And that's where we want the glucose to be. We don't want that glucose to stay in the bloodstream and have our blood glucose or blood sugar running too high. We want that glucose to enter into the cells to be used as energy. Then in our next slide, we see the pathophysiology with pre-diabetes. So what we find here is in the condition of pre-diabetes, insulin just doesn't work as effectively to unlock that cell door. And so there's really a condition where folks are experiencing a bit of resistance to insulin. And a lot of times the pancreas then it will work to try to release more insulin to help lower blood sugar levels and try to overcome that insulin resistance. So we find then in the body what happens is the blood glucose, the blood sugar starts to creep up and be a bit higher, and then insulin levels also start to creep up and be a bit higher. And we're not going to go into kind of the different implications that has, but that can be problematic for the body to work to manage normal blood sugar levels when we're finding those two items are increasing. And just walk us through a bit of animation here for how the pancreas is making more insulin. We see on the screen, it's working really hard. More insulin is being produced. An overwhelming amount sometimes. The pancreas is working really hard trying to do its job, but sometimes it's just not enough. We see there that it's not able to unlock that door. It's not able to get the blood sugar into the cell very effectively. So then we see blood sugar levels then start to rise when we're not having that effective transfer of insulin opening the door and the glucose or the blood sugar entering into the cell. So that was just a brief kind of overview of very simplified what happens with the pathophysiology in the body with and without prediabetes. A lot of times folks, kind of the next question is, well, how is this diagnosed? How do I know what my numbers are, where I'm at for blood sugar control? And so really the difference that we see for the testing that is typically done in a healthcare provider's office, the difference between prediabetes and diabetes is how high the blood glucose levels are reaching. So prediabetes, that's a condition where your blood glucose levels are higher than normal, but they're not high enough yet to be classified as type 2 diabetes. So I have on the slide here 3 different levels for lab tests that you might see at your healthcare provider's office. The bolded one in the middle, the pre-diabetes, that's what we'll be focusing on today. But I like to give that reference point for folks to see kind of what the other numbers are. When we are testing for pre-diabetes, there's a couple of different ways that your healthcare provider will test for this. The first one is a fasting blood glucose, that they might have a person fast for at least 8 hours and then obtain blood work. And if the fasting blood glucose is between 100 and 125, that's elevated above the normal result, so more a pre-diabetic level. The next test there is the A1C, or sometimes you'll see that the hemoglobin A1C. And what this is it's kind of a look back in time. The A1C test, it measures your average estimated blood glucose over about the past 3 months. And we see the range there for the hemoglobin A1C is 5.7% to 6.4%. So if the A1C falls within that range, that's a pre-diabetic level. Blood sugar, blood glucose is running a bit high. The last test that's listed on here is an oral glucose tolerance test. And this is something where a person will drink a glucose-loaded beverage. And so the goal here is to kind of be your own guinea pig and test your body, see what the response is when a person consumes a high level of sugar. So the little drink, it contains about 75 grams of sugar or glucose. If you've ever completed this test before, it really doesn't taste very good. And then they measure in a certain number of hour intervals how your body responded to manage that load of sugar. And was your body able to lower blood sugar to about 100 to or less than 140 would be for someone without diabetes. But if that's the range between 140 and 199 in response to that test, that's a diagnostic criteria for someone having prediabetes. Then reducing risk. So that's the goal today, is talk about reducing risk for developing type 2 diabetes. So we're going to talk in more detail about healthful food choices, being physically active. So we'll go in a lot more detail in just a few moments here. But the second two bullet points, the losing weight if someone is overweight or having obesity, what the studies have found is that if a person loses approximately 7% of their body weight, that helps to reduce insulin resistance and helps blood glucose levels to be more in the normal range. And just for reference, a 200-pound person, if they lost about 15 pounds, that would be a 7% reduction in body weight. And then the last bullet point on here is quitting smoking. Smoking has been found to really very significantly increase the risk of type 2 diabetes. So about 30 to 40% higher risk for someone that is smoking. And that risk is also associated with how many cigarettes a person is smoking per day. And so that's something very challenging to stop using tobacco products, to stop smoking, but recommended to reach out to your healthcare provider for assistance with that. So now moving into the physical activity recommendations portion. When I talk with a lot of folks about physical activity, body movement, there seems to be sometimes a misconception about that definition of exercise. So physical activity, that's really any movement that is carried out by your skeletal muscles. So any movement, it's getting up, getting out of bed, doing all those tasks around your home or work. Those are physical activity. When we talk about exercise, that's kind of a subset of physical activity. So it's a planned, it's a structured, it's a repetitive and intentional movement that's really intended to improve or maintain physical fitness, which is different than just kind of getting up and going around and doing normal daily work or household tasks. Then exercise guidelines, that's our goal here, is to be participating in exercise. Cardiovascular exercise, the goal here is to perform this for a minimum of 150 minutes a week at a moderate intensity. So that's kind of a key point there. At moderate intensity, we want to find that breath is quickening, heart rate increases, and you start to sweat a bit. Heart rate should range. It's going to depend on the individual, but making sure that you're cleared by your doctor for physical activity. Heartbeat will be about 130 to 150 beats per minute. And then if someone is going to exercise at a higher intensity, the recommendation is to reduce that by half then. So about 75 minutes in the week. Higher rate of intensity, the goal for heart rate here is about 150 to 170 beats per minute. When we look at resistance training, this is something not as often as the cardiovascular activity, that just 1 to 2 days per week, adding in some activity to increase muscle strength. And you want to start with about a 5 to 10 minute warm up, like a cardiovascular warm up, if that's by brisk walking, maybe doing some jump rope or something to get blood flow to the muscles to help prevent injury. And then the goal for the resistance training is completing those strength exercises, about 10 to 15 repetitions for a couple of sets. So a little bit more detail about the cardiovascular exercise. The goal here is body movement that gets your heart rate up, quickens your breath, and you're sweating a bit. So a couple of times per week, aiming for this 2 to 5 days a week, whatever you would like to do. If it's dancing, if it's swimming, if it's walking, gym classes, there's a lot of different options in our local areas at swimming pools, gyms, at senior centers, sometimes we'll have classes as well. Chair exercises, sometimes folks struggle with mobility or are concerned about going a long distance from their home. So absolutely you can do a chair exercise routine or workout videos. That's something some folks, they aren't comfortable going out in public and exercising. So you can definitely participate in physical activity from the privacy of your own home. The goal here, it gets your body moving, you're burning calories, and you're strengthening your heart. Resistance training, this is our next category here. So the goal is a little bit less often, about 1 to 2 days per week. And this also can be a variety of things. When we're talking about physical activity, about the exercise, ideally we want it to be something that the person enjoys. So for resistance training, if that's lifting weights, some people really enjoy doing that. Other folks do not enjoy lifting weights or they don't have access to weights. So body weight training can be a great alternative. So that would be something like squats or push-ups using the weight of your own body to increase muscle mass. Resistance bands, that's a great option as well. If someone has ever participated in physical therapy, sometimes they'll be given those resistance bands. So they're not weight-based, but you're using the resistance to help increase muscle mass. And then Pilates or yoga, these are activities where, again, you're kind of using your body weight and you're kind of going through different positions or poses where you're increasing your balance and your strength through holding those poses and increasing muscle mass. So all of those exercises, whatever you would like to do, they help with increasing muscle mass, strength, and balance, which is really important, especially as folks age. Benefits of physical activity. I kind of had to pare this slide down a bit. There's so many different benefits of physical activity. So number one, what we're talking about here today is diabetes prevention, prediabetes. The number one benefit that we find here is it lowers blood glucose. So that sugar, that glucose, it's a form of energy. So physical activity literally burns that energy up. It helps to lower blood glucose, lower those blood sugar levels. We also find regular physical activity, it improves cholesterol and it helps to lower blood pressure as well. And then overall, kind of longer term picture, it helps increase that muscle mass and it helps to support a good, healthy metabolism to help enable a person to maintain a healthy body weight. And then, of course, as final note here in physical activity, last but not least, certainly, is safety. We want to make sure that folks are safe. And so most people are fine to start a physical activity program at a low to moderate intensity, building up to a higher intensity if you wish. But some folks, it's probably wise to check with your healthcare provider first, just to make sure that it's okay to start an exercise program and if there's anything you need to be aware of for safety. And then be ready for your physical activity. So wear comfortable clothes, wear shoes that fit well. You want to be sure that you're not going to have the wrong equipment to help you exercise at a good level. And then if it hurts, stop. This is something that you want to be cautious. If you haven't been active for a while, you don't want to have an injury and then prevent yourself from being active. So if you have any pain, pressure, numbness, especially in your arms or chest, you want to make sure that you slow down, stop. If you're feeling dizzy, really unusually tired, physical activity, it should kind of wear you out. It should make you tired, but it shouldn't be like an exhausting feeling in the middle of the activity. That can be a sign something's not going right in the body. If you feel your heart kind of start to skip some beats, that's something also that you want to be aware of, that you probably should make an appointment with the doctor just to check and make sure that you're okay to continue being physically active. So moving on from physical activity, now we're going to go into the food portion. This is most folks' favorite part to talk about. We are going to talk about just kind of patterns of eating to help support healthful blood glucose levels. Really, our goal here is we want to eat a wide variety of food that folks enjoy and it nourishes the body. What I have on the screen here, this kind of image, is what we use in Samaritan a lot of times to talk with people about healthful eating patterns. We kind of refer to it as our plate method of eating. And what this is, it's a template to follow. A lot of times people struggle with really structured diet plans or having to eat this, not that. That can be really challenging for folks. So when we're looking at plate method, we're not really talking about a specialized structured diet plan. It's more about kind of filling in the spots and using this as a template for eating your meals. So we'll go ahead and break this down a little bit more. So kind of the knee-jerk reaction sometimes for folks when they hear that blood sugar is running a bit higher or they've been diagnosed with prediabetes is they find carbohydrates, that's the food type that makes blood sugar go higher and faster than any other food. So knee-jerk reaction here is to just stop, to stop eating carbohydrate-based foods. And sometimes this can help to an extent to lower blood sugar levels, but a lot of times when I work with folks, they find this isn't sustainable for them. That's not something they can continue doing to really having a low level of carbohydrates. And that's something we don't want folks to eat very low levels of carbohydrate. They're missing out on a lot of great nutrients if they're restricting carbohydrate-based foods. Sometimes folks will really struggle with low energy levels as well because carbohydrates, they provide that glucose that's the energy for our bodies. So we want to have kind of a happy medium approach here. So perhaps a bit less carbohydrate, but also talking about the types of carbohydrate a person is eating in their meal pattern. Look through my notes here real quick. This is an important section on the carbohydrates. Okay. So more foods, kind of the rest of the plate. These foods, fat, protein, and non-starchy vegetables, they don't make blood sugars go up really. They have a minimal impact on blood sugar. And so what we find with this plate method of eating, it's the sum of everything that helps to control your blood sugar levels. So you want to be eating those carbohydrate-based foods, but incorporating non-starchy vegetables, a variety of those. They are high in fiber, low in carbohydrate. You want to be getting in some protein-based foods. Those also help to regulate blood sugar levels. So that protein, the fiber from the vegetables, and typically a little bit of added fat, either into the vegetables or fat included in the protein, that can help with blood sugar or blood glucose balance. So more detail on the carbohydrates. So we want to include these items. We want to keep eating these items, but we kind of have two subgroups here when we talk about carbohydrates. There's complex carbohydrates, and these items, they contain higher levels of fiber and protein, and they're actually a bit resistant to digestion. So they still have carbohydrates in them, but they don't make blood sugar or blood glucose levels go up as high or fast as some other foods. The other area, the other subtopic here for the carbohydrate types is the simple or refined carbohydrates. So these items, they have lower levels of fiber and usually lower levels of protein as well. So with that, those items, they are not resistant to digestion. They can be pretty rapidly broken down. When we think of simple carbohydrates, these items, these foods are made of really short chains, a bunch of short chains of sugar molecules. They're really easy to digest. They break down quickly. They taste sweet. So if we're thinking about, like on the slide here, a cupcake or a cup of juice, those items have a sweet taste sensation. These items, since they aren't resistant to digestion, they're broken down quickly, and that translates to a fast increase in the blood sugar or blood glucose levels. So blood glucose really can kind of shoot up sometimes. And then we can also find folks experiencing a crashing type feeling after they eat these items. So what happens is that blood sugar really kind of goes up quickly when you eat these items, but then blood glucose can really drop rapidly after consuming these items. So it's just a quick increase. Then blood sugar can sometimes kind of be crashing back down, kind of a little bit on like a blood sugar or a blood glucose roller coaster. And that pattern, that makes people feel really poorly when they experience that, a rapid increase and then drop in blood glucose levels. So simple carbohydrates, you want to enjoy in moderation, but not have too often. The next item is the complex carbohydrates. So these items, they're made up of long sugar molecules, long chains. That takes a longer time to digest for the body to break down. And these items aren't very sweet. So the image here is on the slide is beans and lentils. Those are legumes. We don't typically associate a sweet taste sensation with those items. Whole grains can fit in this category as well. And again, not very sweet when we think of those items. These items, they just slowly increase blood glucose levels because they are more resistant to digestion. It just takes a longer time for the body to break this down and then get that glucose out into the bloodstream. And since they are more resistant to digestion, these items typically have higher levels of fiber and protein. They can help make a person feel full for a longer period of time. So the next question a person typically has, as we're kind of working through the recommendations here for food, is the how much. It's like, okay, I get it. I understand. I need to keep eating carbohydrates. I need these foods for health and for energy, but just how much? Because people are really concerned about blood glucose levels and preventing type 2 diabetes. So this chart on the screen, this is a generalized guideline for folks for carbohydrate intake at meals. So this is not a daily amount, this is a per meal amount. So we can see there's a pretty big range here, but when we work individually with people, this is something that it really varies quite a bit how much carbohydrate or how much energy a person needs. It depends on their gender, their activity levels, what they do for work, if their work kind of is it a high energy job or they're up on their feet, or are they sedentary, kind of sitting at a desk computer situation all day? And then also what a person's weight goals are. Are they looking to maintain weight, to gain weight, or to lose weight? Because that impacts how much food a person eats during a day, including the level of carbohydrates. And really this table, this is like a starting point for evaluating patterns of eating and how much carbohydrate to get in. And you have to kind of try it on for size is what I tell people. It matters how satisfied you are after eating a meal containing the various carbohydrate levels, what your energy levels are, since carbohydrates help to supply that energy for the body. And then also longer term approach, what do your blood sugar results, your blood glucose look like when you get tests done at your doctor's office to see what's happening with that glucose metabolism in the body? So all of these are factors for how much carbohydrate a person should eat on a regular basis. Portion size is a big important part here as well. We want to make sure that a person understands how much to eat of the various items on that plate method of eating. So this is a loose reference for portion size based on the hand. So if you're looking at a full fist, that is something that's going to be more equivalent for the dairy yogurt servings, grains, if you're having those on a regular basis, fruits, vegetables, and vegetables will actually be 2 fists, that's 2 cups. So that's kind of the equivalency there. The palm, that's a reference for a protein or a meat serving, having that be roughly about 3 ounces. And then for a fat serving, that is roughly the size of the thumb, or sometimes you'll see the reference as the index finger. So about an ounce or a tablespoon for fat sources. But this is just something quick reference. A lot of people say, I don't have time to track food intake or use measuring cups if they're out and about. So this is something, a quick reference for portion size just based on your hand. And then more detailed recommendations for all the different foods that we're recommending to eat on a daily basis. So we'll break this down kind of group by group here. Mainly what we're looking at here is a predominantly plant-based diet. So we're looking at a lot of servings of vegetables, fruits, whole grains, beans and lentils, nuts and seeds. All of these foods come from plants. We still complement in with lean proteins and dairy. These are very nutrient-dense foods, dairy and meat-based proteins. So a lot of folks still choose to include these in the diet, but the majority of the foods we're looking to come from plant-based sources. And we're not going to go into too much detail about patterns of eating today. Last year for the Healthy Minds, Healthy Bodies series, there was a Mediterranean diet webinar and then also a DASH diet webinar. So those are up on the website, on the YouTube channel. If you want to reference those back, it'll give you more detailed instructions around those patterns of eating. So our first group here, non-starchy vegetables, that we want a bunch of servings per day. A lot of times folks are a bit overwhelmed by how much vegetables are recommended to consume. But if you look at the serving size, it's really not too much. And if you're thinking about eating a salad, most folks usually eat a couple of cups just in a salad, even not a very large salad. So this is something you want to get these vegetables in. And when I talk with folks, it's almost trying to think about, for all your different foods, how can you add vegetables in to complement? If it's an entree item, that's something, how can you add just like a vegetable side or vegetables as a complement to that meal? And then also the question typically comes up, does the vegetable have to be fresh? And no, it does not. You really want to make sure you're just getting vegetables in as often as possible. So fresh, frozen, canned, all of that is absolutely fine to have. It's like the most important thing here is just getting it on the plate consistently. Fruit-based items. So fruit is a carbohydrate that it gets broken down to glucose in the body. And for that reason, we want to have more whole fruit that is a bit more resistant to digestion and can help to control blood sugar levels. It has higher levels of fiber. The stomach has to work a bit more to break it down. When we have items like juice or dried fruit, that has already been processed a bit. And so we find it's less resistant to digestion and it can contribute to blood sugar levels going up a bit higher when those items are consumed. Same recommendation for fruit as vegetables, fresh, frozen, canned, absolutely fine to have all of those different types. You want to consistently get that in on a regular basis. Fruits and vegetables are loaded with nutrients, so very good for the body. Our next grouping is the whole grains and starchy vegetables. So about 4 to 7 servings per day. Again, people kind of same with the vegetables, they get a little bit shocked that that's the recommendation. Sometimes folks feel that's a high value to consume. But looking back at the portion sizes, some of the portion sizes are a bit on the small side for what as a society we typically are served or eat on a regular basis. So either using some measuring cups at home to determine portion sizes or using that hand reference for portion size is helpful here. We also want to make sure with our grain-based servings that they're hearty whole grains. These items are going to be higher in fiber and protein, so that's going to increase the resistance to digestion. So they're going to resist that digestion more, and what that means for us is that blood sugar is better controlled. We see just a moderate increase in blood sugar when we're eating these items that are higher in protein and fiber for our grain-based sources versus a more refined product. Like cereal, dry cereal usually makes blood sugar or blood glucose increase quite a bit. Chips, crackers that have been more refined, those are responsible a lot of times for higher levels of blood sugar. Low-fat dairy is our next option here. So at least a serving on a daily basis. Even as folks age, they need to continue to get calcium in. That's important for bone health. So one serving at least a day, 1 to 3 servings. Fermented dairy products, this is a great source for good, healthy bacteria for the gut. So kind of, getting a couple different nutrient requirements in here. You're getting your calcium, but then also lots of healthful bacteria, probiotics for the gut. Plant-based options, that's absolutely fine to have in this category. So if it's like an almond milk, a soy milk, oat milk, whatever it may be, that's something, it's fortified with calcium. It's going to be a good nutrient source. When you look at plant-based milks, you want to make sure you check the label for carbohydrate content. Some of those are quite low in carbohydrate content, and others can really be quite high, and those can make blood sugar go up a bit more. Fish, poultry, and lean meats that we want to be getting in protein servings to complement the vegetables and carbohydrates that we're eating. So all different types of protein are absolutely fine to have. They all have different nutrition profiles. So that's where it's recommended. Include them all if you like to eat those items. So fish and seafood, that's a lean protein source that is high in omega-3 fats, which is great for heart health. It's great for the brain. Poultry, when we look at poultry, that's a great lean protein source. You can help to lower the fat content by removing the skin or a little bit of fat that's present under the skin. And then lean red meats, those are absolutely fine to be adding into the diet. Any mammal meat is red meat, so beef, pork, lamb, those are all red meats, and you want to be choosing lean sources there. Eggs is the last item included here. So eggs, they can be a bit higher in cholesterol and saturated fat. So we see the recommendation is about 4 to 7 whole eggs per week, but unlimited egg whites. Those are much lower in the cholesterol, no cholesterol. And so have as many egg whites as you would like, and you can complement that with a whole egg as well. Legumes, so beans, lentils, split peas, that all goes in this group here. We want to be eating about 1 to 2 servings per day. And for some folks, this recommended pattern of eating is a bit lower in meat-based protein than what they've been accustomed to eating in the past, just for typical eating patterns in the United States. So legumes are an excellent lean protein source to help complement those needs that the body has for protein. They are a carbohydrate, but they are kind of the poster child for a complex carbohydrate. So they're just loaded with fiber and protein, so they're not going to be responsible for making blood sugar levels go up too high. Nuts and seeds, these kind of fall in a protein and a fat category. So we see the recommendation just 1 to 2 servings per day. They are very nutrient dense and a bit high in calories. So the serving size is quite small. We see 2 tablespoons of seeds, just a tablespoon of nut or seed butter, or about 1/4 cup of nuts, or just kind of what can fit in the palm of your hand in the center there. Then heart healthy fats. We want folks to eat fats. They help to make you feel full at meal times. They help your body to absorb nutrients. Some vitamins are fat-based, fat-soluble, so you actually need some fat to get the benefit from those. And they make food taste good. We want that. We want food to be tasty when we eat it and be satisfied. So absolutely fine to add fat in on a regular basis. Again, we're looking more at plant-based sources and unsaturated fats, that those are what we have found are more healthful for the heart and helping to maintain good, healthy cholesterol levels. And our last group on here for food choices are desserts, sweets, added sugars. A lot of what we find for food interactions in the United States are a lot of celebrations, meeting with friends or family, and sometimes those are centered around sweets or birthdays when folks get together. So it's absolutely fine to still continue to have some of these items. You just want to be cautious about your portion sizes and not having sweets too often. That's something, these items can have quite a bit of sugar. They're usually not resistant to digestion, and so they can make blood sugar spike up or blood glucose levels spike up quite a bit. And the last bullet point here, the second bullet point, sugar sweetened beverages. This is something to be aware of, where these items as a liquid, they make blood sugar go up really quite quickly. And that is something, if that's consumed on a regular basis, that a person might want to evaluate their patterns of eating, because these items, they can really stress the pancreas by having it produce high levels of insulin, trying to combat those really quite high levels of blood sugar. And then just in summary here for preventing type 2 diabetes, kind of our takeaways here are: participate in physical activity on a regular basis. This is something, body movement is really important for helping to control blood glucose levels. Quit smoking if that's something that a person is doing. The increase there in diabetes risk is 30 to 40% greater. So very high risk for someone that is smoking. Eat a wide variety of foods. So as we kind of went through those different recommendations there, we want to have lots of different foods that we're eating on a daily basis. Eat complex carbohydrates, so aim for half of your grains being whole grain sources that are going to be more resistant to digestion. And then limit or avoid those sugar sweetened beverages. And then last item on here, using plant-based fats that are a good source of unsaturated fat. And then a lot of the information that was provided here today and some of the graphic resources, this was provided by NovoCare. And so their information, their website link is here on the slide. And then also the information that we provided today was very generalized. So this is something that it kind of helped get you some direction, but you want more personalized recommendations for you. That is something you can contact your doctor and request a referral to your local nutrition and diabetes education programs, that we have these sites at all 5 hospital sites. So kind of wherever you're at, that we can act as a resource for you. And then also, I had my 2 wonderful colleagues, Heidi and Melissa. They helped with this webinar, so thank you very much to them. And then also our Samaritan marketing group. And then at this time, we had some questions that came in during this session today. So Heidi is going to help me with asking those questions and fielding those questions.
Thank you, everyone, for coming today. So Cheryl, we had 3 questions in the chat. Our first came from Dory, and she wanted to know about smoothies and kind of where they fit into the carbohydrate counting.
Yeah, that's a great question. Smoothies can be a great resource for folks that really just either enjoy the taste or are busy and on the go and want to kind of get everything in there and get out the door. So smoothies, you do have to be a bit cautious because sometimes if you're adding more carbohydrate sources, that can kind of turn into an equivalent of juice, which is a more refined carbohydrate and can make blood sugar go up a bit faster and higher. So when you're making a smoothie, you want to make sure that you're adding in protein sources, fat sources, vegetables, that those will help to balance what you're getting in that smoothie. So you absolutely can have smoothies, but just making sure that they're not completely carbohydrate based, but adding in some of those elements of protein and fat and fiber to help them be a little bit more well absorbed in the body and not make blood sugar go up as much.
Our next question came from Jeffrey, and he was wondering if there is a dry cereal that is more healthful.
Yeah, so dry cereal, that's something a lot of folks enjoy eating, but usually very refined, so can make blood sugar go up quite a bit. So if you're looking for a cereal option, you want to find something that is high in protein and fiber. So there's some brands out there, like Kashi in the past has had a grain-based cereal that's higher in protein, higher in fiber. And I recently saw when I was at Costco that I believe it was a Premier Protein. It might have been some other brand, so don't quote me on that. That it had a cereal that was a bit higher in protein. So if it has those elements, if it's more complex carbohydrate with higher levels of protein and fiber, that's not going to make blood sugar increase as much typically.
All right, our next question came from Mary, and she was wondering about sugar substitutes.
Yeah, so sugar substitutes, we didn't touch on that today in the webinar, and that's a whole bunch of information out there. So for folks that do enjoy sugar sweetened beverages like soda pop or energy drinks, there are alternatives sometimes that are made with sugar substitutes, or even just using a sugar substitute in place of something like honey or traditional table sugar that can be helpful to people for keeping blood sugars down a bit. There's been some new studies that have been coming out, though, about the impact on the body. And part of what happens is that sugar substitute, why it doesn't make blood sugar go up, is because it's not digested. So there's starting to be some new research that's coming out on what that is doing, the impact to the gut bacteria, that it does have some impact on the bacteria, that it can kind of kill them off. So for folks, I really recommend that if they enjoy items that have sugar substitutes, that's okay to do. It helps to control blood sugar. Sometimes folks that they choose not to have those items though, and be really cautious with portion sizes or just avoid it.
Our next question is from Brooke. She was wondering if we have any book recommendations for the nutrition guides.
You know, there are so many options out there. A good website to look at for some nutrition recommendations is Old Ways. That was in the Mediterranean diet presentation. I actually presented that last year. So Old Ways, they actually have some recommended reading on their website. My Plate is an excellent resource. And then as far as book recommendations, I can't think of anything right off the top of my head, but we will record, the webinar's being recorded, and folks that registered will send out a link with some of the questions so I can look further and get some recommendations for further reading. Heidi is also a diabetes educator. Do you have any book recommendations that you give for folks?
I know that Calorie King has a nice
Mm-hmm.
book that they sell that has kind of an overview of things. But there are also a lot of great links online. I think that would be great to send an email as well.
Yeah.
And then our last question here is from William. He asked, any special recommendations for those who need to lose weight or just follow the guidelines?
I would really recommend with the guidelines that we covered here in the webinar today. I work here at Samaritan as an educator, and I work with folks sometimes specifically just on weight loss, and really following the recommendations that we talked about. And body movement, those are essential elements. So really working at those, and sometimes even increasing physical activity to a higher level where someone is being active for about 300 minutes a week or 60 minutes a day, an hour a day. That is something that can sometimes help with increasing weight loss. And so that would be the starting point that I would recommend for folks. And then also, weight loss takes time. Sometimes when I work with folks that are losing weight, it takes years. I sometimes see folks for years and they gradually move towards those weight loss goals. So starting with the guidelines here, and then also being patient with yourself. If you're not seeing immediate results, it does take time for weight loss.
Okay, well, thank you again, everybody, for joining us today. And your feedback is valued. So if you could take a moment to complete the brief survey, which is now available in the chat area, that really helps us. And then please watch for a follow-up email that will include a link to the recording.